Evening, everyone. Hello, my cubby. Thanks for watching. Remember to subscribe. Alrighty. Hello, everyone. It's Eloy from Quailer 100. Good evening. It is May 27th at 5:25 in the evening. And here's the update. So worldwide, there are 5.6 million cases. 91,333 were added today. 354,983 deaths. An addition of 4,452 today. God have mercy on their souls. May they rest in peace. In the United States, 1.67 it's 1.697 million cases and over 100,000. It's in line with what Dr. Fauci and Dr. Birx had reported. So we're in the 100,000 mark. So that's what's going on. So worldwide, I think there are still a lot of places that are being, have stricter quarantine. I read that New Zealand does not have a single COVID patient in hospital, which is crazy. They're 4.8 million, so they're the first to not have any hospitalized COVID patients. I think they discharged their last patient yesterday. So that's great. Doesn't mean that they don't have any more COVID, but looks like they're way ahead of the curve with everyone, and they did it with very strict, stay-at-home restrictions. Like I said, Italy's opening up pretty much anywhere. I think even Japan has opened up, but I think it's restricting 118 countries from, hold on a sec. Sorry. Oh. 118 countries from traveling to Japan. And one of those, a couple of those places include the United States and the Philippines. So they're not allowing international travel. The situation in the Philippines, I don't know if they're taking, travelers from other countries, but I think internationally they are. I think a lot of OFW, overseas Filipino workers, are still stuck at the airport. I guess they're trying to find transportation home, and I think that's still very limited. And I guess that there were about 14 cruise ships, and I was wondering, wow, that's the first time I've heard cruise ships go to the Philippines. Well, it turns out that they were actually holding OFWs, and they were actually they're out there quarantined and being tested. I thought it was just like, oh, it's going to be the next tourist spot in Asia. So, but I guess it's just a lot of Filipinos working on cruise ships that were just being sent home. So that's what's going on locally. In the United States, not much about New York. I'm not really hearing much about New York in the news lately. And then Louisiana, there were supposed to be hotspots. It's less and less, I think. But I think it's because everybody's trying to open up. There's still a mix that this is kind of too early. I'm one of those, and the probably 80% that says it's maybe a little too early to open up. People are worried about the economy. So as my son would say, when people think of money before people, it says that's kind of like a sad state. So yeah, when money before human life. He says that's sad. So he's a very smart kid. As far as California, like I said, it's opening up. The reports today from the public health director, which is a doctor, she was reporting that we are actually having more positive cases of COVID, but she thinks that's because we are actually testing more. So the more you test, the more positive you may have compared to, very few tested. And I think what's happened is that when California first started testing, they were testing the really sick ones, and they were getting a lot of positives. Now that it's pretty much open to everyone. So, like I said yesterday, Dodger Stadium is a capacity of 6,000, and it's anyone. You don't have to be a frontliner. You don't have to be sick. You don't have to be old. I think it's just general testing now. So she was saying that there were over 4,400 healthcare workers. Well, actually, frontliners who actually tested positive, because what was done when I got tested, I was one of those frontliners, and I guess I tested negative, but there were over 4,400 who actually came to be tested that were positive. So 4,400, and I don't know how many were tested at that time. And probably they have the number. They know what percentage that would be. And out of the 4,400, a majority of them were healthcare workers. And a lot of those healthcare workers were nurses. So if you start breaking it down, so 4,400 frontliners, not all of them are nurses, but a majority of them are. I think they're over 50%. So let's say 2,200. And out of the 2,200, a lot of them were in skilled nursing facilities. So, and out of those, I think there were like 12 or 15 who perished, who died from COVID. So it's a low number, but if you're the one that's dead, or if you have a family member who died, that's a big number. So she's saying that although the numbers are going up as far as positives, but she's thinking it's because there are more people tested. And the good thing about these statistics is that there are fewer patients in hospitals that have COVID, and fewer people are dying from COVID. So that's good news. So even though we have a lot more positive, and I think it's part of their decision why they're going to start opening up with a lot of restrictions still, mask and stuff like that. And you know what? You see a lot of people not wearing masks anymore. It's just, it's easy to just say something, but you know what? They're within their distance, and they're not wearing any mask. And I just try to avoid them. And I think I'm choosing to fight my battles. I think if they're out in the outside a building, and and they're not around anyone, and who knows if they have it or not. And even if they do, the probability is low, I would think, for me. And I hope I'm right. So, yeah, as far as where I work, we have actually a lot of patients, but though we only have 84 who tested positive as far as inpatient goes. We've had more as outpatients, but those have been handled really well. So 84 testing positive inpatient, and about, I think, eight patients perished. So that's pretty much what we have. It might even be less than 8. So we continue to test using the swab. Although we have the antibody, it's reserved for certain cases that have to be approved by infectious disease. So as far as vaccine goes, I think it's about the same. I think the market went up today because of news of more opening of services, and so. But on the downside, I'm seeing a lot of bad news for the economy. Looks like Boeing is about to lay off about 13,000 people. So that's going to add to the already over 24 million people that are going to be employed. So yeah, that's kind of like what a couple of weeks ago we were talking about COVID. My colleagues and I, now we're talking about the economy. So So hopefully, both will, have a positive outcomes. Where what I mean was that hopefully COVID, we get a handle on, and the economy gets better. So with that, that's what's going on this side of the world. That's the update. So have a good night. Take care. We'll see you tomorrow. Bye for now.